This tutorial will demonstrate how to use the WSU panoramic machine. Begin by turning on the unit. Log into EagleSoft in Radiology Room G with your username and password. Be sure there is no sensor plugged into the CDR port. From the operatory screen, select the View Images icon up at the top, sort by patient last name or ID, then search for your patient and select them into the system by double-clicking on their name. From here, select New Exam at the bottom left corner, select Panoramic, then right-click inside of the image box outlined in red. Select Acquire From, then Scanner. It will take a moment for the program to pull up on the screen. Press the Home button on the control panel to move the machine to the starting position. Once the Twain program has pulled up, select your settings. Begin by selecting the proper size of the arch, adult or child. Select between pano, bite wing extraoral molar or premolar, then the patient's body frame, small, medium, or large. Then, move the cart in the doorway with a sign facing away from you. This will prevent people from entering the area from around the corner during the exposure. Next, prepare the pano machine for exposure. Begin by lowering the machine closer to the patient's height. Open the temple and forehead supports, then cover the bite block using the proper covers found in the designated drawer. Obtain either a tray or a cup from the clinic, then ask the patient to remove any personal items, any metal objects, and place them on the tray or in the cup. Next, if the patient has signed consent for it, place a lead apron on the patient with the front side open. The lead apron should remain slightly open in the front to prevent potential projection onto the image. The lead apron should not overlap in the front as seen in this video. Guide the patient into the machine, raise or lower the machine as necessary, and instruct the patient to grasp the handles, stand up straight, and hold still during the exposure. If the PID interferes, have the patient take a few small steps forward. Position and adjust the bite block. Teeth must be placed in the grooves on the bite block. For edentulous patients, place a special block under the patient's lip into the mental. Turn on the light by pressing the light bulb button. Adjust the head to allow the Frankfurt plane light to pass through the floor of the eye orbit, and the external auditory meatus is parallel to the floor. You will also want to adjust the head to the left or right so that the mid-sagittal plane light is aligned correctly in the middle of the nose. Check the patient's spine and occlusal plane, then make any final corrections to the patient's position. Direct the patient to close their lips around the bite block, swallow, then place their tongue at the roof of their mouth. Check that the computer says ready. If not, hit the home button on the control panel of the machine again. Once this is done, step at least 6 feet away, keeping the patient in view. Locate the button on the wall outside of room F. Hold the button down until the exposure is completed and you hear a chime. Here is an example of what you should hear. Make sure you are watching your patient and talking them through the procedure. Once the exposure is complete, release the forehead and temple supports, back the patient out of the unit, and remove the lead apron. Return the patient's personal items back to them, and make sure to thank them for their cooperation. Don gloves or remove overgloves to remove any plastic barriers used. Disinfect handrails, mirror, keypad, exposure button, and lead apron. Images take a few minutes to process. When it is ready to view, adjust the contrast as needed by sliding the circle buttons back and forth, click OK, then select the Return All button, click the image at the top of the screen, and then select Get Images at the bottom. Make sure to remove all barriers and disinfect all surfaces worked with in the radiography room G. Radiology support can help you with this if you are running low on time during the appointment. Make sure to sign out of EagleSoft and the computer before leaving. Lastly, raise the machine back up to its original position to be ready for the next clinical use.